Hi, welcome to our Pharma Topics channel. Welcome to the 8th series of B.Pharm 5th semester pharmacology portions. It's related to Unit 2, Hematinix and plasma volume expanders. Up to series 7, I'll be giving in the description box. Kindly go through it and make use of it for your exam preparation. First is Hematinix. Hematinix are agents required for the formation of blood and treatment of anemia. The list is iron, folic acid and vitamin B12 or Hematinix. They transport and storage of iron. Iron is actually absorbed in ferrous form from the diet and transported with transferrin for the formation of blood or stored as ferritin or hemosiderin. Oral iron preparations are ferrous sulfate, ferrous gluconate, ferrous fumarate, ferrous succinate and ferrous ammonium citrate. Parenteral iron preparations are iron dextran, iron sorbitol, citrate. The parenteral preparations are preferable only when the oral preparations are not tolerated. Therapeutic uses, they are used for prophylaxis or treatment of iron deficiency anemia, that is microcytic hypochromic anemia. Adverse effects: epigastric pain, nausea, vomiting, metallic taste, constipation and blackening of stools. Iron poisoning can occur at high doses. The antidote is desferrioxamine or deferriprone. Folic acid is used in treatment of megaloblastic anemia and in pregnancy to prevent the neural tube defects. Always folic acid should not be given alone, should be supplemented with vitamin B12. Vitamin B12 is indicated for megaloblastic anemia, pernicious anemia and to correct the neurological abnormalities in the diabetic patients. Let us see about plasma volume expanders. It is of two kinds. One is colloids, dextran, gelatin polymers, polyvinyl pyrrolidone, hetastarch and human albumin. And crystalloids, they are normal saline dextrose. Therapeutic uses, they are used as plasma substitutes in hypovolemic shock, burns and extensive fluid loss as in emergency conditions. Actually, these colloids, they draw the fluid from the interstitial space and they put them back on the vascular tract. Whereas the crystalloids, they increase the plasma volume. That is why both of them are called plasma volume expanders. They are contraindicated in cardiac failure, pulmonary edema, renal failure and anemia. The most commonly used plasma volume expander is dextran. It is obtained from sugar beet. It is available as two variants. One is dextran 40 and dextran 70. Dextran 40, it is fast acting, short acting and improves microcirculation in case of shock. It prevents the Rolex formation of the RBCs and have an anti-sludging effect. Adverse effects, it is antigenic, it can block the renal tubules and can cause renal failure. That is why it is contraindicated in renal failure. Dextran 70, it is more commonly used and it expands the plasma volume which remains for nearly 24 hours. It interferes with the coagulation, blood grouping and cross-matching. Gelatin products and hetastarch are very similar to dextran. They don't interfere with the coagulation, blood grouping and cross-matching. So it's a very short information of the Hematinix and plasma volume expanders. I think it will be useful for your exam preparation. Thank you for listening. Happy learning. Kindly share this to more of your friends. Kindly subscribe to our Pharma Topics channel for further updates. Kindly go through all the series and make use of it and score well in your university examinations. Thank you.